What do you call boogers on a diet? Slim pickings. Why did the loser stop dating the sloth? He never made a move. How do you know if you're talking to an extraterrestrial? Lots of probing questions.
You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve, with my little pals Dr. Scott, the traditional Chinese medical practitioner who keeps the alternative medicine wackos at bay. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have in the studio Dave Ray Cecil from DaveRayCecil.com, singer-songwriter, well-known to people on the show. Hello, Dave.
Hello, Steve. Hello.
And Cliff Andrews, also known on Twitter as WM the Intern, or was. He was going to change it. Did you ever change it?
I did change it.
Oh, you did change it?
I did.
We'll talk about that in a second. Thanks for being here, Cliff.
Yeah, thanks for having me.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question that you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD. Follow us on Twitter at Weird Medicine or at Lady Diagnosis. She will be back. Or at DRScottWM. And Cliff, what's your Twitter now?
At Cliff Medicine.
At Cliff. Oh, I like it. Okay, at Cliff Medicine. Follow him. He has like 3 followers. We need to do better than that. Visit our website at drsteve.com for podcast, medical news, and stuff you can go or buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, singer, songwriter, clinical laboratory scientist, registered dietitian, or whatever. All right, very good. So, Cliff, glad to have you here.
Thank you.
What we're going to do at the beginning of the show that's going to last about 50 minutes is do a pre-recorded interview we did with Gunnar Esiason, and there's a whole reason why Dave's here, and it's all explained in the clip. Let's just go to the clip here in a second, but first, don't forget stuff.drsteve.com for all your shopping needs. If you didn't get that thing that you wanted for Hanukkah or Christmas, Kwanzaa, Boxing Day, whatever, go to stuff.drsteve.com or Festivus. And you can just click through to Amazon and get it. Of course, you know they have everything. Or you can scroll down on that page, and it has things that we've talked about on this show. The Navage, which is the motorized neti pot, one of the greatest inventions of all time. It's got different supplements that we have data behind that are actually effective for whatever things that they're indicated for. So check out stuff.drsteve.com. If you want the best earbuds on the market for the price, go to tweakedaudio.com and use offer code FLUID. You get 33% off. There's nobody gives 33% off of anything on the internet. Sometimes you get 5% or 15%. 33% off. So if you buy a $60 thing, then it'll be $40, which is awesome.
Pretty good
Or you
stuff.
buy 3 of the same thing, you only pay for 2 of them.
Yep.
So go to tweakedaudio.com, offer code FLUID, best customer service in the business too. If you want to lose weight with me and get to your ideal body weight finally for the first time since college, go to noom.drsteve.com. You sign up and you could do 2 weeks for free. And then if you decide to stick with it, it's just a 3-month program. Not like Weight Watchers, no points, none of that. It's not a diet either. It's a psychology program. You get 20% off if you do decide to sign up. Noom.drsteve.com. It's noom.drsteve.com. And if you're lazy like I am and you want to know how many calories you're putting in your gaping maw at least 3 days a week, I use freshly.drsteve.com. Cliff, back when you were with us before, I think we were doing Blue Apron, which was awesome. I love Blue Apron. They may come back and be an advertiser someday. Blue Apron was cool because they send you just what you need to make whatever food that you're going to make that night. So if you need 2 radishes, they'd send you 2 radishes. If you needed an ounce of, apple cider vinegar, you got an ounce of apple cider vinegar. It was awesome. There's no waste, but you had to make it yourself. Then I went to Tara's Kitchen where they chop up the stuff for you, and it was kind of an unwieldy thing because and I have a way that they could make their business model work, but it came in this giant insulated crate, not good for, the environment and stuff. And of course you'd send it back to them, but then there's all the gas and, the carbon that you're burning, getting this stupid refrigerator back and forth. And it had little things in it, little drawers, and that would have the 2 radishes already cut up. So it was nice because you'd pull out the drawers, dump them in the pot, and make your stuff. So I liked that, but it was a little cumbersome. If they just did vacuum sealed baggies, it would be so much better. And then recycle the baggies. But anyway, that's Tara's Kitchen. Well, I progressed from making it myself to letting them prep it to now I just let them make it for me. And so I go to freshly.drsteve.com and they deliver fresh prepared meals that make eating right super easy. You can use my link to get 6 dinners for $39 for 2 weeks. It's $20 off each week. You give it a try. If you don't like it, you just cancel it. But I've had some good reports on that. It's microwave, so it's going to be microwave food, but it's a lot more food than you get, say, with a lean cuisine. Yeah. And it is hand prepared. It's not made in a factory and by robots. So freshly.drsteve.com. If you'd try it, let me know. If you want archives of this show, why would you after this 7-minute, advertisement? Go to premium.drsteve.com for $1.99. You can get archives of the show going on. Use the app at the App Store or Google Play. But you can also go to our website. You can get a thumb drive of all of these shows too.
That's cool.
And so that's on there. It's like $30, and that's $25 for a 32 gig thumb drive, and that's only half full. So you got you can partition it and use it on your thing, and then and that's shipping. And then the last thing is Dr. Scott's website. Last but not least, simplyherbals.net, the home of Dr. Scott's Simply Herbals nasal rinse. Which do you have it in stock now?
It is back in stock. We're getting ready to put it back on. We're going to put it back on the website on Monday.
Awesome. Yep. Greatest stuff in the world.
Good stuff, yeah.
I'm proud of you.
We did a whole thing last time about peppermint oil and its anti-inflammatory properties and that kind of stuff. So it's pretty neat. There is some data on that.
Yep.
So, all right, very good. So let's go to our interview with Gunnar Esiason, and then we'll be back at the end of that. Gunnar is a 28-year-old person living with cystic fibrosis. He graduated from Boston College with a bachelor's degree in 2013. Now, we're going to talk in a minute. That was very unusual when I went through training, and I went through training in the early 80s, and to have a 28-year-old graduate from college who had cystic fibrosis was not something we saw every day. Gunnar works tirelessly as Director of Patient Outreach and board member of the Boomer Esiason Foundation, a nonprofit organization his parents founded upon learning of his cystic fibrosis diagnosis. And Gunnar, welcome to the show. And
thanks, Dr. Steve. Thanks for having me.
Yeah, thanks, man. When you and I first started talking, I had no idea Boomer Esiason was your dad. And I don't know if you are aware of this, but your dad and Anthony Cumia, ex of the Opie and Anthony show, apparently got in a fight in the 5th grade. And Anthony tried to hit your dad in the head, in that big noggin of his, and broke his wrist.
Yeah, I mean, honestly, it sounds like a story that I've heard quite a few of my dad's childhood stories. That certainly sounds like one of them.
It's so funny. But anyway, Gunnar is currently pursuing a master's of business administration at the Tuck School of Business at Dartmouth. Oh, okay. Well, I know Dartmouth. I used to live in Springfield, Vermont, if you know where that is.
Oh, yeah. Yep.
Yeah, I worked Yeah, it's not that far. I used to send all of my acute patients that couldn't be kept at our hospital at Springfield up to Dartmouth Medical Center.
Yep.
So Gunnar is big on people living with chronic illnesses to feel empowered to advocate for themselves. And that's really why I wanted to have you on, because first I was reading in your Twitter feed about a nightmarish encounter you had with the medical profession, and I always love to just crap on some of my colleagues from time to time when they do stupid stuff, and I would crap on myself if I ever did anything stupid. But so I wondered if you don't, give us a little bit of background on the cystic fibrosis, but also I want to hear about this story. And then the reason we've got Dave Ray Cecil here, just to get all our cards on the table, is his daughter is, how old now, Dave?
She's 5.
She's 5, and she was found to have cystic fibrosis.
We had a prenatal diagnosis.
Okay, so yeah, things have really changed.
Yeah.
Used to be, the kid would be 1 or 2, and we'd figure it out. So, but anyway,
you're not wrong. I mean, I was actually misdiagnosed negative right after birth. So my parents went in the early 90s, about 2 years before actually knowing that I even had CF.
Oh, just thinking that you were a sickly kid, I guess.
Yeah, that's exactly what happened.
Yeah. So talk to people a little bit about what cystic fibrosis is. We'll give them all background so we're all on the same page.
Yep.
And then we'll talk about your insane episode that happened. And then Dave's got some questions. We all have some questions about where cystic fibrosis is going right these days. So go ahead.
Yeah, absolutely. So, again, thanks for having me on.
Yeah, man.
Cystic fibrosis is a inherited condition. It's genetic, meaning we're all born with it. Those of us who have it, it's on a very high level, it's a protein dysfunction disorder that sort of creates a number of diseases to manifest in the body. Most primarily in our lungs, where we have thick, sticky mucus that traps bacteria or irritants, and over time, that sort of just goes in a horrible direction. And in the old days, you were just talking about it, Steve, where, kids born with CF, it was really very much a childhood illness. Yeah. And we've made some really amazing strides in cystic fibrosis over the past 10 years. Since we've been involved in the charity world, we've raised about $140 million, our family foundation, and we've worked strongly alongside the National Cystic Fibrosis Foundation here in the U.S. And we've seen within the last 10 years 4 cystic fibrosis specific drugs make it from the test tube to the patient, and it's really transformed the nature of the disease within the recent years here.
Yeah, we were just talking about Trikafta is one of the things.
Yes, Trikafta, yep.
And this is a big deal. It was approved for patients 12 years and older with cystic fibrosis that have that 508 delta mutation. You want to talk about it a little bit, and we'll just kind of.
Absolutely.
I have ADD, so I see a shiny object and it's like, ooh, I'm.
Yeah, no, we'll jump right in. I was actually a trial participant in the Trikafta trial, and in no small way that drug has changed my life. When I graduated from Boston College, 2013, my health was in peril back then. I was very quickly headed towards end-stage illness, because one of the primary issues that we deal with in CF is actually antibiotic-resistant bacteria in our lungs,
sure.
As I was kind of talking about. And over time, the access to the antibiotics and the efficacy of the antibiotics sort of start to wear on us. And for me, that's really what happened in 2013. From the 5 years that after I graduated college, I think I was in and out of the hospital, every couple months. I went through gotten, 24 medical procedures.
Yep.
I spent more than a cumulative year on antibiotics just to really keep myself stable. And then 2018 rolled around, and I was invited to be a trial participant in the Trikafta trial. And that drug changed my life in a matter of hours.
Wow.
So what it does is
What?
it actually, in a matter of hours. So what it does is it corrects the CFTR dysfunction at the heart of cystic fibrosis. The CFTR is found primarily in our bronchial epithelial cells, which is like our lungs,
Right.
As well as other parts of the body too, where it sort of shows up. But primarily the lungs, and within hours, the viscosity of my thick, sticky mucus started to change.
Get the heck out of here.
Within a matter of days, my cough went away, and then a week later, I was, back in for a clinical trial visit, and my PFT, my pulmonary function test, exploded. We don't ever see that number go up.
No.
But mine did that one particular day, and ever since then, it's just really changed my life.
So were you in this? Okay, so I'm looking at the FDA approval. It said the first trial was a 24-week randomized double-blind placebo-controlled trial in 403 patients. So were you in that trial?
So what it was is Vertex was actually in a position to test two sister drugs. So the one that became Trikafta, VX445, and then a sister drug, VX659. I was actually on 659, and the results for the two were actually parallel. They were the exact same.
Wow.
The one that was chosen, 445, which became Trikafta, ended up having a little bit of a different side effect profile. I've since switched to Trikafta, and I haven't noticed a difference at all. It's basically the exact same.
Yeah.
But I was one of the initial trial patients in the Trikafta program.
Wow, yeah. It says in each trial, the primary analysis looked at increases in the percent of predicted forced expiratory volume, which is in 1 second, which is basically for the lay folks out there that, this is spirometry. So you blow into this tube as hard as you can, and it's looking at how much can you get out in a second.
Yep.
And obviously, if you got crappy lungs, it'll be less, you can get less volume out in a second. And it's an established marker of cystic fibrosis, lung disease progression. And it increased this in both trials. It increased about 14% from baseline, but this was just over, a few weeks. So I expect that it probably increased even more than that over time. So what's your ppFEV1 now? Do you know?
So I actually don't share that out of concern for medical security, medical privacy.
Totally fine. Understood.
But I will say that according to some metrics, I was in the category of severe respiratory illness.
Yeah.
And now I can consider myself to have mild respiratory illness.
Wow.
So that's pretty significant change. In the years leading up to Trikafta, to the trial, I was going through maybe 3 or 4 procedures a year, most notably either bronchoscopies where they go in and they sort of suck out the mucus and they do biopsies and stuff like that, or a PICC line insertion, which is essentially a long-term IV. For some of those listeners who may not know what that is.
Tell them.
And in the
You're sticking these kids with these needles just over and over and over again. They finally came up with a way to do a sort of a central line that's peripheral. In other words, you stick it in a vein out in the arm, and then it can go into the central circulation, so you can use it longer. So.
Exactly. And in the first year after I dosed Trikafta, I didn't go through a single procedure. So, the changes in my life have been remarkable, and not only my lung function. I've gained some weight, and I've my clarity in life is great. I'm no longer dealing with the stress of feeling like I'm going to die.
Right.
Which is why I'm in graduate school now, because I can finally look at my future and expect to have a future.
Yeah. Yeah, science. This was allopathic, not naturopathic, right, Dr. Scott?
Allopathic.
Yeah, okay, very good. We'll give ourselves one of those.
You never hear me complain about that.
Yay, science. No, Dr. Scott's not one of those. He's a true complimentary practitioner in that, we work together very well, and he doesn't try to treat cystic fibrosis with astragalus or astragalus.
This one came out of the lab. They identified the CFTR mutation in '89, and now 2019, when it was approved, 30 years of backbreaking research and work to bring CF to where it is now.
So I went to medical school 82 to 86, and then I did residency 86 to 89, and so the gene was just identified at the end of my medical training. So all of the kids I saw with CF back then, if a 16-year-old CF patient, most of those kids were doing inhaled antibiotics like tobramycin or gentamicin. And this whole business of antibiotic resistance was really a nightmare. And then they started to develop pancreatitis and things like that. And Gunnar, does it drive you crazy when you see antibiotic abuse out there, when people are demanding antibiotics for viral illnesses that just increase antibiotic resistance in the whole population? I never thought of that before, but that's got to be something that's sort of enraging to a CF activist.
Yeah, I think that's like our next crusade. I haven't cleared my drug-resistant Pseudomonas aeruginosa. It's still in my body.
Yep.
It's really going to be there for the rest of my life, or until we sort of figure out that problem.
Yep.
And that's really my next biggest crusade, is sort of looking at different technologies across the healthcare industry that are going to be working to tackle the antibiotic resistance problem. And yes, it does piss me off when I see people abusing antibiotics.
Yeah.
Because quite frankly, I don't have too many left that I can use.
Right.
And unfortunately, in the world in which we live, the market right now just cannot handle a new antibiotic entrant. We've seen 2 companies this past year go bankrupt simply because Big Pharma has left the antibiotic space, and they've left upon these boutique pharmaceuticals to take on the job. And on one hand, we're encouraging antibiotic stewardship. We're like, don't use antibiotics until you absolutely have to. Yet we're hoping people develop new ones. It just doesn't work.
Right.
So we're really reliant on the market to change. We're reliant on the government to pass the Disarm Act, which will hopefully stabilize the economic incentives around the antibiotic development.
Well, this is one of those situations where government funding would also be appropriate. When you've got these things should not become orphan drugs.
No.
When antibiotics become orphan drugs, it's ridiculous. So, but anyway, all right. Well, that's cool, man. Hey, tell us. Dave has got a bunch of questions for you because he's, his daughter's quite a bit behind you, and the Trikafta, of course, isn't indicated until she's 12, so she's got a few years before her. And he's got a nightmare from something that happened at Christmas. But tell us the story where you and I first started talking, because I think you were on Twitter, and I went, dude, you got to come on my show and tell this story, because, like I said, I love to crap on my colleagues when they really screw up. But anyway, what happened?
So I was a sophomore at Boston College when this happened. And like most people with cystic fibrosis, when we go off to college, we established managed care, meaning we contact the local cystic fibrosis center. I'm from New York originally. And we have our CF doctor communicate to the local doctor on the ground and, sort of establish a sort of an emergency scenario. Like if something happens, what should the patient do? And it was cold and flu season, and I developed some sort of flu-like virus. So I followed my established plan to the cystic fibrosis clinic that I was going to. I won't name the hospital because this ended up becoming a learning situation. I don't want to throw anyone under the bus.
Yeah, no, I get it.
But so I ended up being admitted to this particular hospital through the emergency room as our sort of plan was established. And I had every classic flu symptom. I had, coughing. I had throwing up. I had high fever. I think I had like 102 fever, sore throat, the whole thing. It was terrible. And it's one thing for someone in the general population to come down with the flu. It's another thing entirely for someone living with a respiratory illness to get the flu.
Yes, exactly.
As you can probably hear in my voice, I'm actually just getting over a cold now. But this particular time I was really, really sick. And so I was admitted to the inpatient unit. I don't think my CF doctor had maybe popped in quickly to see me and check on me and sort of start medication treatment. But this medical center is a massive teaching hospital in Boston. It's one of the bigger ones.
That sort of narrows it down.
Yeah. So, I'm sure you can imagine which one it was. It was associated with an Ivy League school that starts with an H. I think it was, I don't know, maybe my first night there. My mom had just gotten there. in comes like what I remember to be the chief resident on my case, the senior resident. And as anyone who's ever been in a teaching hospital would know, there's sort of like a rotating carousel of like nursing students, of medical students, of residents, of fellows. I mean, everyone wants to come see like the sick person and like sort of like, give their 2 cents.
Right.
And that was me. I became like subject one of like whatever was happening to me. And this resident came in, and along with like a number of like little followers, everyone in a white coat, and they started like examining me, and on my arms they noticed that I have a bunch of scar tissue from the PICC lines that we were talking about. So when I get a PICC line placed, not only do they stick me with the catheter, they also stitch them in, because when I was young I used to love to play sports, and I've had 1 or 2 of them fall out, so I've always gotten them stitched in as I got older. So
they immediately assume you're a IV drug abuser.
Yeah,
yes,
heroin
exactly.
user.
Okay. So the senior resident on the case like brings her people back and starts to like consult with them, and out loud she was like, well, I think this guy is actually a drug user. I think he probably doesn't have the flu. The flu test is going to come back negative. He's violently shaking. He's he looks like he's sweating. He looks
they thought you were going through
withdrawals.
withdrawal.
Yeah, DTs.
Yeah, so they thought I was going through withdrawals, and I was just so unbelievably sick when this was happening. I just remember being like totally flabbergasted. And to paint a better picture here, a lot of us with cystic fibrosis we're exposed to years of medical trauma. So we all develop what I call procedural anxiety, in the sense that when we're in the presence of care providers in a very unfamiliar situation, where I was admitted to the emergency room to a hospital that I had never been to. I was panicked. I probably was shaking. And I guess what? I also had 102 fever. I was feeling like shit.
And that's the one thing, by the way, that would tell you this is not opioid withdrawal.
Right, it's not drugs.
Because you have all those symptoms that you mentioned, but you don't have a fever with that.
Yeah.
But anyway, especially in flu season. I mean, come on.
Yeah.
I know. It was, and it's like, it's very well established that I have cystic fibrosis. Like if you type in cystic fibrosis into Google, like I show up.
True.
There's no secret that I have CF.
Right.
And like, especially the cystic fibrosis clinic, like, I was a patient of theirs. They knew who I was. And my mom was there, and my mom was just like totally dumbfounded that they actually said that about me in a teaching hospital, a setting that was like supposed to be about, enriching education about doctors, and things like that. And it was just one of the most ridiculous things that I think we'd ever both been a part of. And I remember like looking over to my mom and just being like, Mom, like, can we go home? Like, I don't want to be here anymore. This is not what I want to do. And my mom, finally asked all the residents to just get out of the room. Like, we don't want you here. Just leave. Come back when you have a cystic fibrosis doctor or someone who's actually paid to do this.
Right.
Come look at us,
Right.
So the next day, the cystic fibrosis doctor came in with that woman in tow. And he gave her like a life lesson right in front of us.
Good.
I mean, it was a beat down among beat downs.
Okay. Did they bring the students in too, because they were the ones that really needed to get that lesson as well?
No, it was just this woman, and it was the doctor was like, this person has cystic fibrosis. Like if he's not getting the care that he needs, like this virus could spell doom for him. This is a very serious thing. And I think what the doctor was doing was he was really showing us what it meant to be an empowered patient, right? He was showing us why it was so important that we spoke up.
Yes.
That was really what it came down to. And for me, it was a learning lesson, because whenever I go inpatient, right, or if I'm ever dealing with a new doctor or a new care provider, for me, it was the first time that I had ever witnessed a very serious mistake. And we know in the United States that medical error and medical mistakes are one of the leading causes of death and injury. In the U.S.
Well, it depends on how you define error, but yes, I know what you're talking about.
At the front door.
Yeah. Oh, sorry, that was my Amazon Alexa going on.
Someone is at the front door.
Okay, hang on, I'll turn her off. Go ahead. Sorry.
And I, for me, it was really a moment that painted a picture about, these things actually happen.
Yeah.
To the point where whenever I go inpatient or I'm dealing with a new doctor, I make sure that I have someone with me who can watch what's going on. I educate them to the fact about what I'm going through, what I should expect from a visit, and things like that. My mom, who's gone through, at that point, 20 years of CF living with me, she knew exactly what was going on.
Yeah.
I kind of look at myself when I'm in a medical setting where, I have almost 30 years of experience inside the healthcare system in the U.S.
Sure.
Like I know exactly what I'm talking about.
Yeah.
I can go in and I can talk about microbiology, I can talk about CFTR expressing in different parts of the body, and I know all these things. And in fact, to this day, I still actually test doctors when I first meet them. So I had one of the really fun things about CF is that we're at an increased risk of colorectal cancer. So we get colonoscopies really young in life. So I had my first one. I'm 28. I finally had one over the summer. It was super fun. And I remember when I met the doctor who's going to perform the colonoscopy, I just started asking him. I was like, well, what do you think about we didn't call it Trikafta back then. I said, well, what do you think about VX445 expressing CFTR in my colons? Like, what do you think about that?
You asked this to a gastroenterologist?
Yeah, so because I wanted to see what he was going to say. I wanted to see if he was going to bullshit me or not. Yeah. And he gave me a good answer, an acceptable answer. I was like, all right, cool, let's go do this. Yeah, cool. That's kind of like the little test that I now give doctors. Yeah. I'm ready to speak their language if I have to.
There are absolutely providers out there that really turns them off when a patient comes in spouting jargon and they know more about this stuff than they do. And then there are other ones who are like, oh, you've got a chronic illness. You need to know this stuff. Mm-hmm. And those are the ones you want to see when you've got something like what you've got.
I mean,
if someone's going to...
The healthcare industry is like a service industry, right? And I'm the paying customer.
Exactly.
And if the guy's not going to give me an acceptable answer, then you know what? See you later. I don't have to be here right now.
Would an acceptable answer to you be, hey, I'm not an expert on that, but I could be in 15 minutes if I go Google it.
Look it up,
Yeah, I mean, it's not that hard to access the British Medical Journal.
Exactly.
Like I can also access it myself.
Yeah, exactly. Okay, cool. Well, Dave, do you want to tell your story at all? I mean, your wife doesn't listen to this show, so.
No. We just had a flu scare, and I'm sort of the asshole of the family because my daughter is.
You were not being an asshole.
No. I'm just talking about in general.
Oh, in general. Now that I'll agree with. Yeah.
I mean, my daughter is in impeccable health, and the reason why is because we follow the procedure of how to take care of the CF challenge to that we don't veer off of that path at all, and so. My wife. There was somebody had the flu in a house, and we were going to
the holidays,
all conjure in one place, and I'm like, no, we're not going to do that. And my wife has a lot of, she wanted to do it, and ended up, I was like, okay, man, and one of the kids who they actually played with, who didn't have the flu, lived in the house of the person who did have the flu, started developing symptoms after the day after. Yeah. She now ran a fever, and my wife was devastated. Now that actually served my wife in a way because whatever was there blinding her vision from seeing went away.
The scales
fell
very
quickly.
Her eyes. Mm-hmm.
Yep.
Yeah, I mean, as far as the we were at another hospital and she was born in a NICU and so we sort of went from Brenner. We went from another hospital to the Chapel Hill, and the reason why is because of similar things that you expressed about. I'm really sensitive, and I can tell when someone is. The lead doctor, we didn't get along, and my wife gets all uncomfortable. When something happens because I will get in somebody's face and really, So, but what I found is that. She would react to her previous experience in the beginning of my sentence, and before I could finish my sentence, she would already have an answer for it. And so I don't vibe with that.
You're talking about the
That's
doctor.
Right, the lead doctor, and I don't vibe with that. And I said, listen, you're not listening to what I'm saying. You're breaking off into telling me, all these things that's not where I'm coming from. And
you're thinking of the next thing you're going to say.
That's right, Dad. And so from that, it led us to, doing some research and moving our daughter. And so we moved her to Chapel Hill, and it's just been, it's fantastic.
You got
the doctor there, man, is able to say, I don't know. And that's what I want to hear, because I want to, because we are a team and we have to move like that. And sometimes I don't know, and sometimes they don't.
I think it's okay for a provider to say, I don't know. It's not okay.
100% is.
Yeah, it's not okay for them to bullshit you.
Yeah.
But it's okay to say, I don't know, but go find out.
Let's figure it out.
Go find out.
I know. That's it.
I've got a lot of my colleagues that just don't want to ever admit that they don't know something. It's like, you can't know everything, but you can find out.
Yeah.
We have up-to-date.
And we have friends. We have friends that know things.
Yeah.
Call friends. hands.
That's absolutely true, and especially in cystic fibrosis. Like every doctor knows every other doctor. There's only however many cystic fibrosis clinics in the country. You know, and I remember when I was talking about how sick I was after I graduated from BC, and there was one day when I was just talking to my doctor about it, and she was like, Gunnar, I don't have an answer for what's happening to you. I've already reached out to 3 of my colleagues who are specialists in the infectious disease world, and we're going to figure it out. I just don't have the answer for you right here today.
Yep.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
And sometimes you think and think and think. I can tell you this from recent experience. I have let's just say a really challenging patient that we did this test and that test, and then I'm brushing my teeth one day and I had a eureka moment, and I said, I know what it is, and I went and pulled some corroborating data off of the National Library of Science, plopped it in front of her. I said, this is it. And these things happen. And if you work collaboratively with your patients rather than being paternalistic, so we're kind of getting out of just the CF stuff, but just no, just talking
relevant.
about paternalism.
It is definitely relevant.
I'm talking to the medical students and nurses and doctors and PAs and Ps that listen to this show, and there are quite a few of them. We've got to be careful not to fall into that.
Yeah, agreed.
You're absolutely right. I mean, we call that movement the empowered patient movement, right? An e-patient movement. It's happening, around us. And I think, the healthcare industry is changing in so many ways, but this one way in particular is, the way it's happening. The era of information in which we live, I'm not advocating for people to go out and, Google their symptoms.
Right.
Definitely don't do that. But if you can have an informed conversation with your providers, that will pay dividends down the road, enormously.
Chronic pain patients are in the same boat, too. And
Well, in some way, what you're also talking about is the person taking responsibility for their own health, because that right there is that you can grow. And my man, I'll have to say it. My mom is whenever she gets anything, she goes and gets a damn Z-Pack.
Yeah,
and she just wants that. She wants to
something.
believe that pill is going to be the thing that gets it, and it's she doesn't take responsibility for her own. Watching her body and seeing what's happening with it and how it's communicating with you in order to treat whatever it has.
And Gunnar, I know you don't listen to the show, but we like to talk about philosophy of medicine on this show too. And when I was in medical school, we watched this video of this guy in the mountains of some third world country, and he was waving palm fronds over these patients. Now, obviously, he wasn't giving them any medicine. They'd come to him sick. He'd wave the palm fronds, and then they'd go away feeling better. And Scott and I know that if we don't do anything, 90% of our patients will get better.
Oh, yeah.
And when you give... So those patients just wanted to be recognized. They wanted their problem recognized, a name given to it, and something done. So when we give someone a Z-Pack for a viral illness where it will do no good. That's exactly the same function in society as waving palm fronds over somebody in a third world mountainous country, because it's really doing nothing. It's just making people feeling like you're recognizing their problem. Now, one other thing, Gunnar, that I wanted to talk about just for a second is this whole thing about influenza, because your issue involved influenza, Dave's issue involved influenza. And we had at least one listener of this show that was a contributor to the show die from influenza, and another one, Richard David Smith, who is the owner of Hyperphysics. He makes energy drinks with his wife, Shatai. Anyway, a little plug for them, hyperphysics.com, I guess. He almost died from influenza, and people will minimize that. It was like what happened with Dave's family. Oh, it's just influenza. It's just flu. It's no big deal. And that no big deal virus killed 1% of the world's population in 1918. And that's unlikely to happen again because of Tamiflu and other stuff. But people who are at risk really suffer when people don't get their flu shots or they're careless about who they're transmitting the virus to. So, think of Gunnar if nobody else. Think of Dave's daughter.
You're absolutely right. I think that when you go to get the flu shot, not only are you protecting yourself, you're protecting those of us who can't get the flu. Like the flu just cannot enter my life. I actually know 2 people with cystic fibrosis right now who have the flu, and they're in the step down ICU. Yeah. Right. That is a very serious thing. And for me, before I came to Dartmouth, I used to coach high school ice hockey, and I would actually have a standing Tamiflu prescription. I know you're not supposed to do that, but those of us with CF, that's a common thing for us to have. And when I remember there were 2 particular instances. I coached hockey for 6 years because I just loved it. In 2 particular instances, I had one student have the flu 1 year, and then I had another student have the flu, 3 or 4 years later. Sure. And as soon as that happens, as soon as I'm exposed, I start the proactive Tamiflu dosing and just start doing it. Because while the flu shot is my best line of defense, and in those 2 cases it obviously worked. You can't be 100% sure that I'm not going to be developing some symptoms. And I think specifically about people who have gone through organ transplants, who have gone through really extensive chemotherapy, and I think about those people when I get the flu shot.
Yep. No, absolutely. Get your flu shots, people. Come on. Jesus. I was going to ask you another thing. Well, let's talk a little bit about let's talk about the future. So what do you, you're plugged into this. What are we looking forward to? What's Dave's daughter, what can she look forward to as far as advances beyond the Trikafta right now?
I think that eventually what's going to happen is Trikafta, just its efficacy alone speaks for itself. It's going to it'll be approved for younger patients, and our hope is that for patients who can start on Trikafta at a very young age, they will not know cystic fibrosis like I knew cystic fibrosis, or like cystic fibrosis. Right. It's going to be a very, very different condition. For all intents and purposes, if you're starting Trikafta at a very young age, or some of the previous CFTR modulators, there's previous iterations that aren't quite as good as Trikafta, but still very good. The disease is not going to manifest nearly as severely. Right. But my fear in that, however, is that while our children with cystic fibrosis are going to be not necessarily perfectly fine, but very, very well off, I'm worried that the adults are going to be forgotten. Right, because although yes, I've started Trikafta and it's changed my life, I still deal with the chronic Pseudomonas. I still deal with bronchiectasis in my lungs. I still have infertility. I still have pancreatic insufficiency. Those things are not going away. Yeah. Because I started Trikafta in my late 20s.
The damage was already done.
Yes, after fibrosis is already sort of manifested in a number of different organs. Yeah. I think that we have to remember the adult CF patients, and we have to continue to pursue stabilization of the antibiotic market, as well as working on other parts of the disease. I still have to do my treatments. I still got to do the vest, but my life looks pretty good. I went skiing this morning. I'm playing hockey tonight. Like, things are good for me. Yeah. But that's not the same for every other CF patient. Everyone still needs help, especially the older generation. The younger generation, however, I foresee very long, normal lives for people with CF that are, born in this era. I've said this already that, we've already seen the beginning of the generation of people with CF who are born with CF who will not die of CF.
Right.
That's already, those people are already alive.
Well, it's like HIV. When I was in training, if you were we didn't diagnose HIV because no one knew it was a virus. They had all these other theories about what it was. Matter of fact, I had a immunologist tell me there's no way that AIDS is caused by a virus. That's just stupid. He called us all stupid if we had that opinion. And of course, he was proven wrong. But now, really, for a large number of people, the vast majority, if they can get the medication, it becomes a chronic illness. Yep. And I've got someone that's very close to me that's HIV positive, and I expect him to live a normal lifespan at this point. So that's what we're going for. For Dave's daughter, are there clinical trials going on of this Trikafta where he could maybe apply to be enrolled to get started earlier with this stuff?
Yeah, so I think I'm not sure exactly how they're doing the age brackets. I think the next sort of level is 6 and up. Okay. The FDA is, obviously for the right reasons, they scrutinize, younger ages. They don't want to be giving kids
absolutely
just crazy medications for no reason. So I think while Trikafta is definitely a safe option for a lot of people, I think the FDA will look very closely, and as will Vertex, the manufacturer of Trikafta, before dosing younger and younger generations, as they have shown to do in the past with previous iterations of CFTR modulators. I will say real quick, Dr. Steve, though, that Trikafta is only appropriate for about 90% of cystic fibrosis patients based on our genetic profiles. We all inherit 2 recessive genes from our mommies and daddies, and what happens is that there's about 1,200 different cystic fibrosis mutations. Any 2 pairs can create CF.
Right.
There's a very small minority of people living with cystic fibrosis whose genetic profile doesn't actually create CFTR protein. So their cystic fibrosis manifests because they're missing this protein that everyone else has, while mine is dysfunctional. This group of people, they don't have it at all. So there's nothing to correct. So those folks still have very classic textbook cystic fibrosis. Yes. And they're waiting for their breakthrough drug. So if you can imagine the emotions that those folks are going through now, to see everyone with cystic fibrosis get better except them, right? That is a very horrendous situation to be in. And unfortunately, the medications that we've targeted for so many years just aren't appropriate for them. So we still have a number of different things that are coming through the pipeline where we're looking at different mRNA medications, different anti-inflammatories. There's actually an endocannabinoid that is entering phase 2 and phase 3 trials.
Nice.
And then of course I guess Vermont's across the border from me, right? I'm old enough to say that. It's not childhood disease anymore, right?
Right.
And I do think that the future for cystic fibrosis is bright. And as I said in my, I delivered the commencement address at St. Louis University School of Medicine this past May. And as I said to the graduating class, I was like, we have this antibiotic crisis that's in front of us. And unless we figure that out, it's going to undermine every single advance that we make henceforth.
It's true. Yeah, we can lose the war against the bacteria. They outnumber us trillions to 1. So yeah, that's one of my things is antibiotic stewardship too. And on this, the 10% of folks that don't have that 508 delta mutation, I'm guessing that one of the answers is going to be genetic manipulation or gene editing, and we are ways away from that. But
I think we're still looking at a decade plus before we get a person with cystic fibrosis into even a clinical trial. In that case, I think it's actually, you're talking about the CF gene being identified in 1989. There was always back then, I was a child back then, but there was a rush to gene therapy back then. And a person with cystic fibrosis actually did go through some wacky gene therapy trial, and it really screwed them up. So, I think gene therapy is like a little bit of a taboo subject in CF, just because it's a classic genetic disease that everyone learns about.
Right.
And it was one of the first, genetically identified conditions. And back then it was, it was basically like pseudoscience that went into trying to fix fix this poor guy, and it just didn't work.
Yeah, I'm guessing what they'll do is when they identify it in utero, is they'll have a virus that can go in. And just add the proper gene to that person's genome and be done with it. But we're a bit away from the time when we can inject embryos in the womb with stuff and edit their genome. But that's got to be the answer for a lot of this stuff down the road. So. Yeah,
and I think that, and as well as this mRNA therapy that we're looking at. So what they're trying to do is they're trying to actually correct CFTR before it's even created, right? So mRNA, for your listeners who may not know, it basically is it's a message that goes to different parts of the body, and it tells the body what to do. So all of us, our body, like just based on our genetic mutations, creates the wrong kind of CFTR. So they're hoping that people can actually inhale mRNA, and it'll actually then start creating the correct CFTR.
That's interesting. So for people who are listening may have learned about mRNA when they were in high school. It carries the message from the DNA to transcription RNA where you're making protein. So I'm assuming that they're going to be bringing this mRNA already tagged with the correct gene, and then it goes in and hits the transcription mechanism, which is un-effing believable, by the way. Cool. Google ribosomes and Google, transcription RNA, and it's this crazy machine that builds proteins, and it's just mindlessly doing it. It's just molecular chemistry, but it's incredibly complex. But they'll bring it already tagged in with the right right message, and then it'll make the right. That's genius.
So if your listeners want to look up a company, it's called Translate Bio. They're out of the Boston area, as many biopharmaceuticals are. They've already done a phase 1 trial on CF, and they did see some success. So they're going to continue going that route. And it's that science to me is unbelievable. Like the Trikafta pill, it's freaking amazing.
Right.
But inhaling mRNA just blows my mind.
Me too. That's a great idea. I'm going to buy stock in that company as soon as we get off of this.
Well, yeah, I mean, you want to talk, dollars and cents here. Like whoever can patent an mRNA therapy first is going to be a very lucrative company.
Yeah. And you don't hear about this like you do with chemotherapy. Oh, well, the medical profession already has a cure for CF, but they're just repressing it. I hear that all the time. I work at the cancer center.
Oh my God!
And it's like I tell people that if we were really repressing the answer and it was that easy, I would be the first one to give it out to everybody and break this cabal of this cone of silence just for the blowjobs.
Yes.
Yeah, I mean, whenever I hear that, I'm like, well, what about hepatitis C? We've cured that.
Yes.
Like, there's no money in that cure. Yeah,
of course.
Yeah, there is. It's been cured.
Yes.
These things are financially stable. And,
literally cured. Those people take the treatment and then they don't have to take it anymore, and it's gone. Mm-hmm. So yeah, it's coming. So Gunnar, we're running out of time. What can people do to help?
So, like I said, the adult cystic fibrosis population still needs, serious funding for research and things like that, as does our notion of antibiotic resistance across the entire healthcare industry. So you can either check out the National Cystic Fibrosis Foundation or our family's foundation at Esiason.org, ESIASON.org. You can follow my blog, GunnarEsiason.com. I'm also on Twitter, like you found me, Dr. Steve G17 Esiason. And then if you want to see me skiing up here in the Upper Valley around Dartmouth, you can follow me on Instagram too.
Okay, cool. Your foundation, the CF Foundation. Tell us the name of the actual foundation.
So the Boomer Esiason Foundation.
Exactly. This is my issue. So your dad has a kid, and the kid has CF, but he starts this foundation, but names it after himself.
He is famous.
I got no problem with it.
Yeah.
It was name recognition back in the day. Like I'd rather people know about CF through that than than not know about CF at all. And
right, a lot more people know Boomer Esiason because he was a hell of a quarterback.
Well, that is true. Because,
he's a hell of a player.
Just to give you a little context, Gunnar, I wanted to see if I asked Alexa who you were, if they knew who you were. So listen to Alexa's answer. Echo, who is Gunnar Esiason?
Norman Julius Boomer Esiason is an American retired football quarterback and former network color commentator.
So
I'll tell you what. it's better if you do that than if you Google, is Gunnar Esiason? The Google auto answer is Gunnar Esiason still alive? That's what you get when you Google is Gunnar Esiason. So we're making progress. That's the way I see it.
Gosh.
All right. Well, let's try this. Echo, who is Boomer Esiason's son?
Here's something I found on Wikipedia. Norman Julius Boomer Esiason is a retired American football quarterback and former network color commentator. Did that answer your question?
No, but thank
Close
you very
enough.
much. So I guess actually it does make sense to name it the Boomer Esiason Foundation just for that name recognition. But anyway, well, listen, man, all the best. If anything new comes out, please come back on the show. Dave, you got any other questions for Gunnar before we let him go? We got 4 minutes.
No, but I really would like to thank you. I mean, a lot of the movements that you've made in cystic fibrosis obviously will affect my daughter. So I had to say that, man. I really appreciate it.
Yeah, thank you.
We're all in it together, right? Every single one of us living with cystic fibrosis, and within the larger and broader rare disease community, we're all in this together until the very end. And I know for a fact that your daughter will live a long, full life, not in spite of cystic fibrosis, but with cystic fibrosis in the passenger seat, because it's not going to be the same kind of condition that all of us have had for so long.
Thank you so much. Awesome. That's awesome. Yeah, thank you for your work on this. And we always, worry about Dave's daughter because Dave's real special to us. And, because of the fact that he has this experience with CF, he would be a perfect person to have at a fundraiser to play music. He's quite the talented singer-songwriter.
Oh, he's awesome.
So I'm just giving...
Oh, absolutely, yeah. I'll get some of your contact info off the air.
Please do.
He is fabulous,
Yeah, that would be awesome. Because he wants to do anything he can to help, and that would be a nice synergy there. Anyway, Gunnar, thanks again, man. Everybody check out the www.esiason.org or learn about Gunnar at his website, www.gunnaresiason.com. Gunnar Esiason, CF advocate and activist. Thanks for being on the show today.
Absolutely. Thanks for having me, guys.
Okay, we'll talk soon.
Hey, take care.
Thanks, man.
See ya.
All right. So, look who showed up.
To be fair, I've been...
Wait, okay, there you go.
To be fair, I've been sitting outside.
Oh, you have?
Yeah.
Oh, why didn't you come in?
I tried. The front door was locked. I rang the doorbell.
Yeah.
That was you. Okay, so remember Alexis said somebody was at the front door and nobody so
No.
who let you in?
Oh, your wife.
Oh, okay.
Eventually.
Eventually. Okay. Did she pull in while you were sitting out there?
Honestly, she may have. I wasn't even after a while. I was like, well, I guess maybe I should go. But
did you call me?
I text you.
Okay, yeah.
Text me.
Okay.
Yeah, if that ever happens again, or call. It's okay to call.
Okay.
Because I would have said, "Oh, here's Cliff," and I would have put you on. But anyway, Cliff Andrews, everybody.
Hey, Cliff.
Dave, you've never met Cliff, have you?
How you doing, buddy? Good to meet you.
So you've seen Cliff's picture, though. He's all over the place up there. Yeah. And Cliff, you've seen Dave's picture because it's right there over Dave's right shoulder. So
yeah. Cool.
So anyway, yeah,
nice.
Cool. Yeah, we probably ought to do another live show somewhere, and we could do music and comedy.
Let's do it.
That'd be great.
Sounds good. We're going to flip over to the podcast side here in a minute, and Dave's going to do... You're going to do a new song?
I'll play one, yeah.
Hell yeah.
Ooh.
And you don't have the chart, so it'll keep Scott from trying to play along.
Oh, terrible. Oh, Lord.
That's not very nice.
It is. That's not very nice. I'm not a nice person. I keep trying to tell you guys that stuff. That was cool having Gunnar on here.
Yeah, he was great.
So.
He was great.
Wow.
Yeah, an awesome advocate for what you're going through. And, you hear about these things and they don't as so often hit so close to home.
No.
But for you, it couldn't be any closer to home.
Yeah.
People who don't have kids have no idea what worry is. Or at least let me put it this way. I didn't know what worry was until I had kids. Mm-hmm. And then that's all I did. I had nightmares about horrible things happen to my kids and stuff. And, that's... And then you have a kid that really has something you got to worry about, and then it just compounds that.
Well, it's interesting that you're talking about that because I don't have any. I mean, You know, I was talking to a lady, and she was inadvertently, without her actually saying it, she was telling me, God, I don't know what I would do if my daughter had CF. You know, I could just sense it. She was playing.
Well, they don't know. Yeah, you know, they don't know what to say. People don't know what to say or do when there's, you know, either they perceive a tragedy or there's somebody that's chronically ill or severely ill. They just, you know, they don't have the tools to.
What I said to her was like, well, you know, it wouldn't matter if your kid had CF or not. And I mean,
meaning what?
I said, look, man, you know, I know that it would matter physically. You would have these things that you would have to take care of, etc. But you're going to do whatever you have to do for your kids, and you don't run around thinking about how bad things are. You just do the next thing for your child. You don't. That's where I was coming from. So I don't have any kind of it should be different going on. Yeah. You know what I mean? Right. If I did, then it would be stressful.
Sure.
This is just what we do.
It's just what it is.
Yeah, it's what it is.
That whole Baba Ram Dass thing, and people make fun of it, you know, but people make fun of two things that I think were actually very profound. And one was Rodney King saying, "Can't we all just get along?" People shit on him, but he's right.
He is right.
Yeah,
we just choose not to.
Right.
That really, I think that was it was so, you know, the most profound things are so simple. It's like, you know, can't we all just get along? It's like, yeah, we can. We don't want to.
Yeah.
So that's one. And the other one was, Baba Ram Dass saying, "Be here now." And that is something that if nobody, well, Scott and I do, and Dave, and maybe Cliff, but, you know, we got to be in the moment,
right,
or we're not living our life. And so, you know, if you have, I say this all the time on the show, so people have heard this 1,000 times, but that's my shrink told me this, and apparently he stole it from AA. But, you know, he said if you have a foot in the past and a foot in the present, you're in perfect position to shit on the, I'm sorry, I fucked that up. If you
past and future,
a foot in the past and a foot in the future, you're in a perfect position to shit on your present. Because that's true. You're just squatting over it and taking a giant dump on the present. And I know so many people that worry about what's going to happen. What are people going to think?
Yeah.
Well, you can't read their mind. Who gives a shit what people think? Or what happened in the past that you can't change. So you know, you might be able to influence what happens in the future, but it hasn't happened yet. You're here right now. And, you're right. So when something like this happens, the most functional approach is this is the hand we've been dealt. Now we got to play it.
Yeah, and the thing is too is that, you know, when you do live in the moment, you know, the past and the future sort of fade away because it's your attention that drives these thought patterns. You know, like if I'm always constantly thinking about the future, I get my I thought I have a pattern that I'm going to, even when I'll get what I wanted, because I'm stuck in this mind pattern of, you know, projecting a future result, okay, well, I got that, okay, and it'll last a little bit, and now, okay, now I got to get something else.
Yeah, you got to do something else. Yeah, you can't ever enjoy anything.
Yeah, exactly.
I had a friend when I worked in software when I was in medical school, and some people who don't listen to this show avidly might not know I wrote 6502 machine code back in the day to help put myself through medical school or defray some of the expenses. But anyway, this guy that I worked with, he was terrified he was going to die. Now, he was probably 26 at the time, already worried about dying. And so he'd work out, he'd take supplements, he'd do all this stuff. And I never saw him actually enjoy his life because he was so worried about his life ending that he didn't enjoy it while he was doing it.
Yeah.
That's when you say, man, why don't you just turn around and talk to death?
Yeah. Well,
you know, that's the thing, you know, is we all walk. I was thinking, you know, it'd be cool to have like what if it was a computer program? You just slide the cursor over somebody and click them and a date would come up over their head. Expiring at this.
Yeah.
I mean, you know, if you go ahead and it's like, this is the way I look at it. we all walk with our death. Everybody in here is going to die.
Carlos Castaneda said that. Are you quoting him, or did this come from you?
No, it's coming from me.
Okay. He said you should always walk with your death, not in a morbid way, but just to remind yourself to enjoy every minute.
Exactly. So this is what. So for me, I got early. I don't know, like 10, 15 years. I got obsessed with death, and I was single, and I had all these little quotes, and I posted them all over my house. You know, little quotes like. I said to life, I should hear death speak, and life raised her voice a little louder and said, "You hear him now." Ooh. You know, just kind of these little things, you know, and yeah. So, but the point is that at that point in my life as well, as I turned around, and because death is walking with us all, but we're all trying to ignore him and outrun him, get away from him and shit. Right. And so I just turned around and said, "How you doing, man?" Mm-hmm. And based on that respect, you know, now I'm walking side by side with him. He grants me wisdom because I know at some point he's going to take the lead. Yeah. And so I am aware of my death, and I live with my death, but it makes the moment so much more full because I know that this shit's I'm passing through, man. Mm-hmm. Come on, man. I'm not trying to be this is not morbid, but this is like accepting it so that you can be released from it, so that you can see that life and death are one and the same, you know?
Yep.
Welcome to Pot Talk with Dr. Steve. And Dave Cecil.
Is the key. Hey, and your resident hippie pothead.
That's true.
Thank you very much.
But you don't do
not
that
you, Cliff,
stuff.
Of course. No, I wouldn't do that.
I can't right now.
I'm the state of Tennessee
jobs,
anyway.
So.
Oh, yeah. Yeah. Well, we've talked about this on the show, too, that which would you rather have, who would you rather employ? Someone that's using pot on the weekend who 2 weeks later has a positive drug screen, or someone who's all hepped up on cocaine on Monday but has a negative drug screen on Wednesday? Right. You know, I'd much rather have the pothead.
Yeah, same.
Any day.
But
there's no justice. I mean, there's a lot of things that are unjust in this world, but that's really one of them is the urine drug screen when it comes to employment. But anyway, that's just, you know.
For sure.
Okay, we're going to do a song?
You want to do this tune?
Let's do it.
Let me give the outro. Hey, thanks always go to Dr. Scott and Dave Ray Cecil. Thank you for coming up today. I just asked him yesterday, hey, we're having a CF advocate on. You want to come up? And, you know,
I jumped at it.
Yeah, and he just showed us up. And he lives, you live 3.5 hours, 4 hours away?
Yeah, only.
Yeah.
I got a Prius, man.
So it's a 4.5 hour trip, right?
Totally cool, man. Thank you for coming. And everyone should check out Dave's music. Go to, like I said, our YouTube channel, and just go to the show that says Dave Cecil in studio. And you don't have to listen to me droning on because, you know, I try to do an interview, but I'm no interviewer. I ain't no Ron Bennington, but you can just click on the links underneath in the comments, and you can go straight to the songs. Mm-hmm. They're unbelievable. They're
beautiful.
They're proud of my engineering skills that day because I was worried that what you do wouldn't come through, and I really feel like it did.
It was great.
I really feel like it did.
Yeah.
It was a pretty good example of your music. So, and we were all just freaking out too. So,
good stuff, Dave.
So, now Cliff, you're going to sing back up on this?
Oh, what?
Okay, he's going to sit back.
If I get the spirit in me, I will. I don't know this
now
song.
You play keyboards or something, right?
I mean, I can play chords, but not at y'all's level. Y'all are like professional.
No, that's bullshit. You should have heard Scott. Matter of fact, we got to do a show where we play Sweet Melissa that you did the first time with GVAC sitting where Dave is, and then play the new one.
Yep. We're gonna make it. We're gonna make a new one. I'm practicing my home studio now. Well, we're gonna do a better, newer one.
Okay, well,
a newer, better one.
The tracks are all there. I'm not redoing the music. It's fine, but you can
the vocals.
You can redo your vocals. But just to hear that, and same way, we could have you in here with a keyboard, and you could plonk some chords down because it's so fun to be in here and just watching other people play. You need to.
That's fair.
You know,
yeah, it's cool.
Okay.
Yeah, we'll do that. If you're gonna be here like you've been, we need to get you involved in that part too. So we'll set you up with something.
Let me hear how loud you are. Make sure I'm not. Turn mine down just a hair, Steve, please.
Okay.
Yeah, I don't want to be too loud.
But play. Just hit a couple things. Okay, there you go.
Okay.
Yeah.
And then let's get Dave just a touch of reverb in his voice.
Check 1, 2. Check 1, 2. Check 1, 2.
Why is that so? Okay, say a couple
check,
words.
Check 1,
okay.
Check 1, 2. There it is.
There we go.
Check 1, 2.
I'm going to pop myself down just a little. All right. What's this one? This a new one?
Yeah.
What's it called?
I don't know what this one's called.
You want to do a contest and let the listeners name it?
Yeah, sure.
It'll be called, Fuckhead McGillicuddy if you do that, but that's okay.
I'd buy that.
I would totally buy that album.
Get to you, I think. I don't know. Something like that.
We'll think of something.
I don't know. Holding you under, dragging you down, pounding like thunder, your heartbeat sound. One more minute, you're sure to drown. Can't catch your breath, so that's what she does. Sometimes she like that, sometimes she yields. In time you'll find out this is the deal. So learn all your lessons, my friend, because this is what life can do. Yes, I've seen that look on a few. You gotta let go of all you lose. Get used to breaking in two. And you can't let these things get to you. You can't let these things get to you. So don't let it get to you. Gone are the things that you wanted to always do when you were young. Replaced by the years of just getting through. It's nothing you ever dreamed of. Life is a wonder passing you by, rolling like thunder. That father time, blink and it's over. You're gonna find this is what life can do. Yes, I've seen that look on a few. You gotta let go of all you lose. Get used to breaking in two. And you can't let these things get to you. You can't let it get to you. Get to you. You can't let it get to you. Get to you. These things ain't always what they may seem. So don't let these things get to you. Something like that.
Beautiful.
That's dope. That's real dope.
That's beautiful, isn't it?
I just wrote that. That's like
on the way over.
Days old.
Hey, on the way over from
yeah.
From your 3.5 hour drive.
It's awesome, man.
Good stuff, Dave.
Privileged to be here with you. I had a couple of clams in there, but if we play that again, I'll have
I forgot some words, so it's good. We're all.
I was playing air mandolin.
I have committed. I'm going to get better at keyboard. I'm going to start practicing,
we need
and I'm going to do it. I'm going to do it.
We need keyboards. We need it.
You inspired me. Your voice is amazing, dude.
It's beautiful. It's beautiful, isn't it? Yeah.
He's got some